Hello, my name is William Cunningham. I'm a DNP student at Robert Morris University, and thank you for taking part in my study titled An Educational Intervention, Nurses and Smoking in Professional Practice. Introduction. Nurses and smoking. All nurses have been educated on the dangers of smoking, yet many of us continue to smoke. The purpose of this educational intervention is to provide new evidence-based information on how smoking has an effect on professional practice and to potentially impact decisions related to smoking cessation. Smoking statistics. Smoking is attributed to about 480,000 deaths each year in the United States, making it the fifth leading cause of death here in the U.S. Smokers die about 10 years earlier than non-smokers. Compared to smokers, quitters showed improved global quality of life and health-related quality of life. How many nurses smoke? There are about 3.9 million nurses in the United States. Almost 400,000 of those nurses choose to smoke. Nurses continue to smoke despite advanced knowledge of a decreased survival rate and a lower quality of life. Does smoking affect a nurse's professional practice? To many nurses, nursing is more than a job. Being a nurse is associated with self-image. If nurses know smoking may interfere with professional practice, would that knowledge affect decisions about continued smoking? Analysis of smoking trends in the Nurses' Health Study revealed that nurses who continue to smoke have decreased longevity and lower quality of life. What is the best way to quit smoking? The most successful smoking cessation efforts involve the use of the 5 A's: ask, advise, assess, assist, and arrange. Intensive counseling techniques. Nicotine replacement therapy. Pharmacological interventions. The combination of all the above has been shown to greatly improve the chance of smoking cessation educational efforts. Are nurses who smoke negative role models? The World Health Organization has identified smoking cessation efforts as a primary goal of all healthcare professionals. Healthcare professionals are expected to be role models for their patients in health-related matters, to include the choice not to smoke. Nurses who smoke set a negative example for new nurses entering the workforce and perpetrate these attitudes. How smoking affects nurses' attitudes and beliefs. Nurses who smoke have different attitudes about tobacco control measures and are less likely to agree that it is their professional responsibility to help smokers quit. Nurses who smoke have significant differences in beliefs with respect to the prohibition of smoking by patients or staff concerned about the effect of passive smoke, the role of smoking in therapeutic relationships, smoking as a source of patient pleasure, and the role of smoking in symptom management. How smoking affects nurses' attitudes and beliefs. Nurses who smoke are less likely to believe that the following are important or effective: role modeling, questioning smoking habits, training in smoking cessation techniques, the efficacy of medications for smoking cessation, the value of nurse counseling in smoking cessation efforts, which has a direct impact on their ability to effectively teach smoking cessation techniques. How smoking affects nurses' attitudes and beliefs. The more nurses smoke, the less comfortable they feel in their ability to help patients stop smoking. Nurses more comfortable with smoking cessation counseling skills are more likely to utilize evidence-based nursing interventions. Nurses who smoke are unlikely to be comfortable providing smoking cessation services and referrals. Do nurses who smoke negatively impact the profession? Nurses are an underutilized resource in tobacco control efforts despite being the primary point of contact in most healthcare interactions. One barrier to nurses as mentors in smoking cessation efforts is the continued smoking of nurses as a group. The nursing profession would be more involved in smoking cessation efforts if less nurses smoked. Does a nurse's choice to smoke affect patient outcomes? Clinicians are important role models for patients, and those who smoke are less likely to counsel their patients to quit. Patients are 28% more likely to quit if their healthcare provider does not smoke. Continued smoking by a PCP is the second strongest predictor of sustained smoking and ranks just behind continued smoking by family members. Nurse smoking and dissension in the workplace. The majority of nurses choose not to smoke. However, those who smoke cause dissension in the workplace. Smoking at work creates conflict in the workplace, described as a war between smokers and non-smokers. Nurses who do not smoke are almost twice as likely to miss their work breaks. This evokes dissension in the workplace and negatively affects patient care. Nurse smoking and dissension in the workplace. Smoking affects interactions between nurses, leading to a perception that nurses who smoke take more breaks, take longer breaks, spend less time caring for patients, and are perceived as being less committed to their profession. Nurse smoking and employer concerns. Employees who smoke are costly to healthcare institutions. Nurses who smoke are less productive, are more likely to take time off, cost more to insure, increase liability costs both from secondhand smoke and first-party disability claims. All of these costs are estimated at over $6,000 per year per employee who smokes. Nurse smoking and smoke-free campuses. 90% of all hospitals nationwide are now smoke-free. More hospitals are becoming smoke-free all the time. At present, over 4,000 hospitals, healthcare systems, and clinics have adopted 100% smoke-free campus grounds. Smoking and nurse employability and earning capacity. 21% of hospitals in the United States have a ban on hiring smokers, and that number grows yearly. This affects a nurse's potential employability. A growing number of hospitals are utilizing nicotine testing to identify smokers and utilize tobacco use surcharges to increase the share of an employee's contribution to their health plan, thus reducing a nurse's take-home pay. Nurse smoking and termination of employment. Nurses can be terminated or fired for smoking. A small but growing number of employers are terminating smokers even if their tobacco use is outside the workplace. Employees can be terminated for smoking, and the anti-discrimination laws do not apply if non-smoking is considered part of a job, as with nursing.